Hey guys, it's Dr. Erica Patterson, physical therapist. Welcome back to my channel. This topic for today is going to be talking about the different type of discharge locations that you can send your patients to once they're done being at a skilled nursing facility. There are a lot of different types of discharge locations. I'm just going to kind of go through and list them and then explain a little bit about each one so you have an idea of what they are and then what types of patients would be appropriate for each one. So the first location is sending them home or to their prior place of living. That is usually most preferred for patients if they can go home with family or caregiver support. And then we always recommend home care physical therapy too, just to follow them along that continuum of care. So that's kind of the first discharge location. The second discharge location is remaining at that facility as a long-term care resident, which means that they stay at a skilled nursing facility or sometimes can get transferred to a different skilled nursing facility where they will get 24-hour nursing support. This can be for people who are a little bit less stable. It's good for patients who wander and need that 24-hour supervision. They need that nursing care. It can range from anyone who functionally is pretty high level or to someone who's really low level or fully dependent. We have that support at skilled nursing facilities, so that's more of a long-term care type of setting. It also can be a little bit less socializing. Sometimes patients are a little bit more confined to their room or just a few different like activity rooms or TV rooms, dining room, that type of thing. And then usually patients are sharing rooms with another person, and it can be a little bit more expensive because it kind of mimics a hospital type setting. So that's a long-term care discharge location. All right, so the next discharge location we'll talk about is an assisted living facility, or called an ALF. There are a couple different types that I'll go into a little bit more in a second, but let's generally define an ALF. So these patients are going to be patients that need minimal nursing services. They do get 24-hour caregiving support, but they don't need too much RN support. They need to be pretty stable and predictable, so people who need constant supervision or who are still really fluctuating medically aren't appropriate for this setting. They do need to have, independence or modified independence when they're ambulating or when they're using their wheelchairs to get around. It's not really a secured facility most of the time, so patients can kind of come and go, family members can come and go. So you want to make sure that they have enough safety awareness to navigate the facility with minimum support. They usually are more of a private apartment style living, so you get a little bit more space, a little bit more private instead of like a skilled nursing facility or long-term care where you have roommates and everyone's in more of a smaller space. And they usually have a requirement at assisted living facilities where the patient needs to have help with at least 2 of their ADLs or more. Now let's break it down to the 2 different types of ALFs. So you have a CBRF, which is the first one, and then a second one is going to be an RCAC. So a CBRF is a community-based residential facility. The people who are appropriate for this discharge location not only have all of the requirements that I mentioned of a general assisted living facility, but they also are people who need to have less than or equal to about 3 hours of nursing care usually. Oftentimes, these are people that benefit from socialization, so diagnoses like Alzheimer's, dementia, people who might need a memory care unit where staff is actually specifically trained to work with patients who have those types of diagnoses, and they have more supervision and safety for people who don't have as good of a cognitive status as some other patients. Then they also usually have 5 or more people. It's more of a community-based type of facility. So that's more of the CBRF style of assisted living. Now the other style of assisted living facility is an RCAC. So a residential care apartment complex. Now this is going to be for people who are much more independent. So again, meet all of that assisted living facility requirements, but then more specifically, it's a very lighter level of elder care. That's kind of how it's defined. So it's less than 28 hours of personal care per week, but there's no nursing care at these facilities. And then the apartments usually are more private. They have more amenities. Of course, you can hire in-home caregiving if you need it, but again, no nursing care. So people that are pretty stable, pretty independent, they just need a little bit of socialization and supervision throughout their stay. Now, for the patients that don't meet assisted living facility requirements, they can have another option of being discharged to an independent living facility, which is exactly what it sounds like. It's basically a patient that's a little more independent, so you're not going to get any nursing care. The only way the patient is going to get care is if they personally hire caregivers to come to their apartment and assist them in whatever ways that they need. So this is more for people who are independent with their ADLs. They're not wanderers, they're stable, they're predictable. They might just benefit from some of the socialization activities that they have and additional support, cleaning, laundry, that type of stuff that they can get caregivers for. Now, the last discharge location I want to talk about is a group home. This is a pretty common discharge location. Sometimes we even see patients that will have been living at a group home for a while, get sent to the hospital for whatever reason and need to go back there. So a group home is basically a more personal version of an assisted living facility. Usually it's exactly what it sounds like. It's a smaller home that has 15 to 20 people usually staying in it. You can get home care services to a group home. There's not as many activities or socialization opportunities for patients, but it is a more intimate, smaller setting, so it's great for patients who need help with their ADLs, who need a little bit more supervision, or who need a little bit of help getting around the facility. Oftentimes I'll send people here who maybe have pretty good activity tolerance, but they might be limited for whatever reason and they can only go shorter distances. That's a great place to send those types of patients because they can still utilize the whole facility, they can get around, socialize, but it's not super taxing on them and they get the support that they need. All right, guys, so just to review, discharge locations include sending a patient home, sending them to long-term care, so remaining at that skilled nursing facility or going to another one, sending them to an assisted living facilities with the two different main assisted living facilities we talked about, a CBRF and then a RCAC. And then the last two, independent living facilities, and then a group home. Let me know if you guys have any questions. Feel free to post in the comments. I know that's a lot of information, but I remember not really talking about that in PT school too much, so I hope it's helpful for you guys. As always, don't forget to like and subscribe as well. Hit that link below to join our community, the Skilled Nursing Facility PT Mentor, where we're gonna keep learning how to level up our careers together as PTs. As always, advocate for yourself and your patients. Thanks for watching, guys. We'll see you in the next one.